This video is for general information only and does not replace medical advice. If you have concerns about your symptoms, please speak to your GP, pharmacist, or dentist. Does fatty liver disease cause a bitter taste in your mouth? Here's what the evidence actually shows. Fatty liver disease is incredibly common in the UK, affecting around 1 in 3 adults. That's millions of people, many of whom don't even know they have it. So it's no wonder questions like this come up. Let's work through it properly. First, a quick overview of the condition itself. Fatty liver disease, medically known as hepatic steatosis, simply means excess fat has built up in the liver cells. The most common form in the UK is non-alcoholic fatty liver disease, or NAFLD. It exists on a spectrum from simple fat accumulation through to a more serious stage involving inflammation and liver damage, known as NASH. One of the most important things to understand about NAFLD is that it's often completely silent. Most people have no symptoms in the early stages, and it's frequently picked up by accident during a routine blood test or scan. In fact, your liver function tests can come back entirely normal even when fatty liver disease is present. When symptoms do appear in more advanced disease, they tend to be vague, things like persistent tiredness, a dull ache in the upper right side of your abdomen, or a general sense of feeling run down. So, back to the original question, can fatty liver cause a bitter taste in your mouth? Based on current evidence, and noting that UK guidelines do not list bitter taste as a symptom of NAFLD, the answer is no. There is no direct link between fatty liver disease and altered taste perception. That said, in very advanced end-stage liver disease, taste changes can occasionally occur, but this would be due to severe liver dysfunction or nutritional deficiencies, not the earlier stages most people are dealing with. There is one indirect connection worth mentioning. People with fatty liver disease sometimes have concurrent digestive issues, including gastro-oesophageal reflux disease, GORD, where stomach acid or bile travels back up into the esophagus and throat, which can cause a bitter taste, but that's the reflux causing it, not the fatty liver directly. So what else commonly causes a bitter taste? The most likely culprits are GORD, certain medications that can alter taste perception, and oral health problems like gum disease or dental infections. If you're experiencing a persistent bitter taste, it's worth speaking to your GP, dentist, or pharmacist to explore these possibilities. When it comes to managing fatty liver disease, current UK guidance focuses on lifestyle changes as the most effective approach. There are no licensed medications for NAFLD in the UK at this time, so the emphasis is on achieving a healthy weight, eating a balanced diet, and staying physically active. Your doctor can help you put together a plan that suits your individual circumstances. If you've been diagnosed with NAFLD or you're concerned about your liver health, it's worth discussing with your healthcare professional what monitoring you might need, which lifestyle changes are most appropriate for you, and whether any symptoms, including a persistent bitter taste, need further investigation. Finally, a word on when to seek urgent help. If you notice new yellowing of your skin or the whites of your eyes, that's jaundice. Contact your GP for a same-day assessment. And if you or someone with you experiences sudden confusion, vomits blood, or passes black tarry stools, call 9999 immediately. These can be signs of a serious medical emergency. To recap, fatty liver disease is common, often symptom-free in its early stages, and based on current evidence, does not directly cause a bitter taste in the mouth. That symptom is more likely linked to acid reflux, medications, or oral health issues. If you're unsure about any symptoms you're experiencing, please do speak to a healthcare professional. If you found this video helpful, give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health content. And drop a comment below if you have questions. We'd love to hear from you.